Halitosis, causes, preventative measures, and treatment. Halitosis is the medical term for bad breath. Is caused by bacterial buildup in the mouth. These bacteria break down foods, creating sulfur byproducts which smell much more like decaying matter or rotten eggs. Poor dental hygiene may be to blame, although this isn't always the case. It can also be brought on by a number of medical issues, such as heartburn, dry mouth, or even an illness in another area of your body. The underlying cause of halitosis determines the course of treatment. Everybody occasionally has unpleasant breath, especially after eating foods like garlic, onions, or other intense flavors. However, persistent bad breath, chronic halitosis, may indicate that you have a problem with your oral health or a condition that is impacting another portion of your body. Halitosis is a sign of numerous medical problems. In other words, it's like a warning message from your body. The first step in treating halitosis is determining its underlying cause. 1 in 4 persons worldwide suffer from halitosis, making it a common illness. Halitosis affects around 31% of the population, according to a research study that synthesized the findings of 13 medical journal articles. The main halitosis symptom is persistent bad breath that doesn't go away. The odor may be strong enough for other people to notice. Halitosis is most frequently brought on by bad dental hygiene. Harmful bacteria infect your mouth and grow out of control without regular dental cleanings, flossing, and other forms of good oral care. This may result in a number of oral health problems, including gum disease, cavities, and halitosis. Halitosis can have a number of causes, not the least of which is poor dental hygiene. Other conditions that can also contribute to poor breath include tonsil stones, head and neck malignancies, gastroesophageal reflux disease, GERD, upper respiratory infections, an abscessed tooth, diabetes, liver or kidney disease, gingivitis, and dry mouth. Make an appointment with your dentist if you have persistent bad breath. A dental cleaning or periodontal, gum, procedure should be helpful if halitosis is brought on by bad oral hygiene. Halitosis may be related to a problem in another area of your body if your teeth and gums are in good health. Your healthcare practitioner can develop a treatment strategy that is personalized for your needs once they have identified the cause of your halitosis. In some cases, your dentist might advise using antibacterial toothpaste or special mouth rinses to fight specific bacteria in your mouth. Your primary care physician can decide whether another illness is causing halitosis if your dentist does not uncover any oral health problems, such as cavities or gum disease. It may take some trial and error to determine what works for you if your chronic bad breath is caused by a medical issue. Your doctor might need to experiment with various medications or adjust your dosage. Or they can request additional testing to pinpoint the precise problem. Before booking an appointment with a dentist to assess your poor breath, these tips can help. In order to decrease the likelihood that the examination may be affected by items you eat during the day, dentists typically prefer morning visits for bad breath examinations. To avoid masking any odors, avoid wearing perfume, scented lipstick, or scented lotions to your visit. Other lifestyle modifications and natural cures for bad breath include: 1. After eating, brush your teeth. Have a toothbrush on hand at work for use after meals. Fluoride-containing toothpaste should be used at least twice daily, preferably just after meals. It has been demonstrated that using antimicrobial toothpaste might reduce bad breath odors. 2. Brush your tongue. Because your tongue is home to microorganisms, gently stroking it can help with odors. A tongue scraper may be helpful for people who have a tongue coating brought on by a large bacterial overgrowth, from smoking or dry mouth, for example. Alternately, use a toothbrush with an inbuilt tongue cleaning. 3. Do your best to floss every day. By removing food debris and plaque from between the teeth, flossing helps to minimize bad breath. Only about 60% of the tooth surface is thoroughly cleaned by brushing. 4. Avoid mouth dryness. Avoid using tobacco, and consume plenty of water instead of coffee, soft drinks, or alcohol, which might cause your mouth to become drier. To encourage salivation, chew gum or suck on candy, preferably sugar-free. Your dentist or doctor may recommend an oral saliva-stimulating medicine or an artificial saliva preparation to treat chronic dry mouth. 5. Clean dental or prosthetic devices. If you have a bridge or denture, make sure to clean it completely at least once a day or as recommended by your dentist. If you wear a mouth guard or dental retainer, clean it every time before putting it in your mouth. The ideal cleaning solution can be recommended by your dentist. 6. Frequently replace your toothbrush. A soft bristled toothbrush should be used, and you should replace your toothbrush every 2 months or when it becomes frayed. 7. Modify your diet. Avoid foods that can contribute to bad breath, such as onions and garlic. Numerous sugary foods consumption has also been associated to poor breath. 8. Arrange routine dental examinations. To have your teeth or dentures inspected and cleaned, see your dentist frequently, typically twice a year. Halitosis is a typical illness that can make people feel embarrassed or low self-esteem. However, having poor breath is not a cause for shame. It's frequently just your body's way of alerting you to a problem. The good news is that treating the underlying medical illness usually helps you get rid of halitosis. To determine what is most beneficial for you, your dentist and primary care doctor can collaborate. Hopefully, everything you learned in this video was helpful and will eventually help you improve your general health. Please tell us if this is the case in the comments section below. And if you want to support the channel, be sure to like and subscribe. I would greatly appreciate it. Thank you so much for staying with me through the very end.